If you're suffering from chronic pain, it's likely that you've tried a variety of treatment options as you search for pain relief. The commonly held theory is that constant, repetitive use can damage spinal structures and develop or worsen an existing back or neck pain problem. While this is true, there is a contributing factor that is rarely, if ever, considered. Tissues need healthy blood capable of carrying oxygen to the tissues for them to repair and rejuvenate. Neuralgia is a term used to describe pain, tingling, weakness, or numbness in locations throughout the body. Neuralgia is one of the most common widespread forms of musculoskeletal pain. When caused by oxygen deprivation, neuralgia can be a real problem, since the actual source is rarely, if ever, correctly diagnosed, leading to years of suffering. Oxygen deprivation neuralgia is a real problem for those who suffer poor circulation to the extremities or any other area of the body that serves nerves, which just happens to be the entire body. All of the nerves and muscle cells in the body require oxygen in order to survive and function. When these cells are deprived of oxygen, even to a small degree, by the ischemic process, painful muscular and neurologic symptoms can and will result. At low levels of oxygen deprivation, the nerve cells in an area deprived of oxygen begin to lose their ability to function correctly. Instead of a clear nerve signal, the nerves produce pain and other neurologic symptoms. At higher levels of oxygen deprivation, the muscles would become affected, causing widespread pain and even the sheer agony of neuralgic spasms. Oxygen deprivation can occur due to an injury or disease process. However, it can also be caused by an imbalanced neuroendoimmune supersystem and the loss of vasomotor control. NEI supersystem interactions with the vasomotor system occur constantly, shaping all conditions of health and illness in our physical bodies long before becoming a diagnosable disease process. The incidence of ischemia being involved in chronic neuralgia pain has been clearly demonstrated in numerous research studies. Unfortunately, most of the studies are exclusive to the brain. Ischemia is a loss of blood flow to parts of the body. It is well known that red blood cell agglutination occurs with type 2 diabetes. The peripheral neuropathy associated with type 2 diabetes is always attributed to entrapments or pinched nerves causing the symptoms. The possibility of vasomotor ischemia of the muscular compartments and the red blood cell agglutination is never considered. While it is important to rule out any disease processes in the potential causation of your ischemic neuralgia symptoms, do not expect that your doctor will get on board with a diagnosis of vasomotor ischemia. Most doctors are simply not trained or are using philosophy-based anatomy, physiology, and neurology, making them unqualified to recognize these types of conditions. Many will deny the very existence in order to preserve their philosophy-based practices. Look at the graphics they use. The blood supply is never seen in the same picture as the nerves. Remember that no part of the body can be understood separate from the whole. Vasomotor conditions cannot be effectively treated by most physical medicine procedures. It requires the combined approach of organ reflex techniques developed by Dr. DeJarnett and NEI supersystem lab testing to access the window of treatment opportunity in these conditions. Anatomical sources of oxygen deprivation can and should be detected quite easily through diagnostic testing. These can be minor or dire health issues, so it is crucial to seek qualified care for any structurally induced or disease-enacted vasomotor ischemic syndromes. Since the possibility of suffering from this diagnosis will not occur to most patients and is not likely to be brought up by your physician, It is so critical to do independent research to learn the facts about oxygen deprivation neurologic symptoms involving altered red blood cell structure or vasomotor imbalances involving the NEI supersystem before entering into any potential misdirected treatment programs. If the underlying cause of the pain is not correctly identified, the subsequent treatments are guaranteed to fail. It is as simple as that. Ischemia is sometimes the true source of pain, when symptoms have been mistakenly linked to a coincidental structural abnormality. There are a wide range of conditions occurring from variable process like regional oxygen deprivation. Ischemia is a very logical source of symptoms when you consider its effects, and the often structurally illogical symptoms suffered by so many patients with chronic pain. This diversity of symptoms would be very difficult to link to virtually every structural diagnosis, save for a bulging vertebral disc, even though the bulging disc has its origins in gastrointestinal inflammation, generating ischemia to the disc itself. Areas of high turbulence in the vasculature accelerate the release of oxygen from hemoglobin. This occurs in the heart bifurcations or junctions of the arteries. Release of oxygen and ATP from red blood cell agglutination and rouleau formation further deprive tissues of needed oxygen and energy. The vasculature must also endure adhesion formation from ischemia, inflammation, and surgical procedures. Conditions such as ischemia, oxidative stress, and autoimmunity impair blood vessels, interfering with blood flow. It should be noted that the whole capillary does not need to be necessarily involved, since only a few rouleaued, aggregated, or agglutinated cells in each capillary are able to block the opening to an extent that the red blood cells cannot pass, causing the whole capillary to cease functioning. Ischemia induces neuronal damage by increasing the excitatory neurotransmitter glutamate. Severe ischemia induces the release of glutamate from both neurons and glial cells in the brain, causing increased excitotoxicity and inflammation. Excitotoxicity is the key mechanism implicated in neuronal death associated with many disorders. Intestinal ischemia occurs when the blood vessels to the intestines become narrowed or blocked due to rouleau, aggregation, or agglutination, reducing the blood flow. Intestinal ischemia can affect the small intestine, the large intestine or colon, or both. The decreased blood flow can cause pain and can permanently damage the intestines. Ischemia is thought to be the most important insult that leads to adhesion development. Autonomic neuropathy-induced functional abnormalities in the abdominal circulation affect the blood flow with deterioration of the abdominal blood vessels and the development of gastrointestinal inflammation. Adhesions can alter the structure of the intestinal blood vessels, further altering the dysfunction. Oxygen delivery depends on the oxygen carrying capacity of the blood, its conveyance from the lungs to the tissues, and the mechanisms that control its uptake and release from the blood. In circulation, there is no specific barrier to oxygen diffusion in the blood vessels that prevents oxygen exit. There is no tracking number. There is no guaranteed delivery. As a consequence, as oxygen continually diffuses out of the blood vessel, oxygen movement throughout the circulatory system is similar to the delivery of water to the garden transported in a leaky bucket. You have to get the water to the farthest part of the garden without all the water leaking out. The faster you can move, the more likely that part of the garden will get watered. However, the more you trip and stumble, jostling the bucket around, the more water will be lost. The same goes for red blood cell delivery of oxygen. Deformed, infected, hemoglobin deficient, and exposure to inflammatory cytokines and chemokines renders red blood cells incapable of proper oxygen transport. There are numerous conditions that account for the oxygen deprivation experienced by various tissues of the body. Mechanisms associated with blood flow regulation, such as vasomotor control of vasodilation and vasoconstriction, would be sufficient to properly distribute blood flow and consequently oxygen supply within the circulation. Are you suffering from chronic pain, cold hands, cold feet, tingling or numbness, chronic hip or back pain, and the treatments aren't helping? Is this you? Should you have any questions, feel free to contact my office. Thank you, and have a great day.